you, Madam Chair.
Representative Bradley.
Thank you, Madam Chair. This question is for anyone on the panel. I would love to know, what outcomes do you define as success? Is that reduced dependency or expanded enrollment? Because as a healthcare provider, Medicaid was not this big, wide safety net of 2 million people, right? We expanded it, and now we want to blame certain bills for it. But truly, we included adults with dependent children, coverage that extends into higher income brackets than traditional Medicaid eligibility, when it was supposed to be a swing for people that have low-income children, pregnant women, or elderly that are poor, and people with disabilities. And now providers like me, when you say things like we're the lowest per capita cost, sure, because we're not paying providers the cost to do business. I'm not getting paid to treat Medicaid patients, and our governor just keeps slashing provider rates. So we can blame bills all day long, but really in the state of Colorado, we cast this big net with ARPA funds, and now we're like, oh no, we have 2 million people, we got to get rid of 500,000 people. So I would like to know if reduced dependency or expanded enrollment is your idea of success, because as a provider, it's not. You're cutting our costs, and we're trying to feed our own families, and we're treating for free. So this problem, we're just kicking the can down the road right now. We need regulations and to go back to what Medicaid was truly intended for and stop casting such a wide net. Thank you.
Ms. Prey.
Thank you, Madam Chair. So we did have about 1.8 million people enrolled on Medicaid at the peak of the of COVID. We're now down about 1.2 million. So we've shed 600,000 people who some have become uninsured, and the community clinics have felt the brunt of that, as have emergency rooms. But we're down to a population that, for expansion adults are either people without dependents up to 135% of federal poverty. That's not a lot of money, honestly. We've done, Colorado Center on Law Policy has done an analysis that we're going to share in coming days that talks about, looks at how much money people have for healthcare costs once they've paid for their rent and their food. We're not talking transportation. We're not talking about eating pizza. We're just talking about rent and food, how much you have left to pay for any out-of-pocket healthcare costs. And it's less than zero in many parts of the state. So people would actually have to go into debt even to cover their housing and food costs. So it's a very low-income population. Expansion adults also include people with children. So that's a sort of a confusing term. People say expansion adults, they think we're talking about just single adults. We're also talking about parents and caretakers who have income between 68% of the federal poverty level, which is super low, to 135. So we have lots of families that are accessing it in what's called the expansion population, that we get that much higher federal match for, 90% from the federal government. So it's a rather good deal for us to have expanded Medicaid. We get 90 cents on every dollar covered for those slightly higher income parent caretakers and those single adults. I totally agree that compensation for providers should be better. I would love for it to be better. It definitely affects network adequacy.